Right, to offer expert perspectives on containment strategies on Nigeria's ongoing cholera crisis, which has claimed 4,778 lives between 2020 and 2024, that's in 4 years, based on NCDC data, of course. Well, we have joining us Dr. Biodun Ogunniyi. He is a National Incident Manager, Cholera Emergency Operations Center, and Assistant Director of Epidemiologists, Head of Health Emergency Preparedness, NCDC. You're wearing so many caps tonight on the show. Thank you so much for joining us.
It's my pleasure to be here.
With over 4,770 lives lost in 4 years, between 2020 and 2024, do we have an emergency situation on our hands? And why is cholera on the rise? And why is it this fatal in Nigeria?
Thank you very much. Good evening, viewers. Cholera is a preventable disease, easily treatable. There is no justifiable reason for anybody to die from cholera. But the circumstances around us continue to predispose people to deaths from cholera, simply because the disease is transmitted through contamination of food or water sources. So when we drink water or food item that is contaminated by feces from an infected individual, then cholera can set in. Then transmission continues when people don't have, especially in communities where people don't have good access to water, potable drinking water, and the environment is dirty. So that's why you hardly find cholera in some highbrow areas, because it's associated. Even if it happens, maybe 1 or 2 cases, but it doesn't become an outbreak. So in this situation we have in our hand, just like the report I just had, there are different preventive measures that could have been put in place to ensure that people don't die from this disease. For a disease like cholera that has been a bit, we use the word endemic, meaning it's mostly around us most time, because funny thing about the organism causing this, the germ causing this disease, is that it can stay for a long period in the environment. Unless it's really intentionally killed or inactivated, it can be there for long. And when the next cycle comes, because it's a seasonal disease, you will observe that there's a period of the year that the disease becomes more prominent or more obvious around us. Onset of rainy season, when people don't have access to good water sources, they have to look everywhere. And it gets to a stage exacerbated or increased by flooding, when this flood washes surfaces that have fecal matters, and that speaks to where people do open defecation a lot. Or sewage system, some also have, what do you call it now, the toilet facilities that are not well dug, maybe latrines and all of that, which can easily, from the runoff of the water from the flood, can wash those fecal matters into the stream or get into even shallow boreholes and contaminate drinking sources. Food items cooked with this water can also have access to these organisms, and the ingestion of such will continue to give the outbreak year in, year out. But what are the key things we need to do as Nigerians to keep ourselves safe? I heard about the last report that speaks to oral cholera vaccine.
Yes.
Vaccines are safe, they're effective, they're very useful, but I would say that in addition to that, because it's meant to complement other intervention efforts, other measures, the primary thing is issue of hygiene. How well is our environment? How well do we keep our environment clean? How well have we stopped open defecation in our environment? People having access to toilet facilities will really drastically reduce incidences of this disease in our environment. The third point is the issue of hand hygiene. Hand washing. I'm sure some people may feel like everything is about hand hygiene, COVID, hand hygiene, cholera, hand hygiene. Yes, because studies have shown that more than 60% of infectious diseases can be transmitted by the hands. Wow. Things you touch, you use toilet facilities, they didn't wash hand properly with soap and water, they keep spreading this. This is a disease that is transmitted through the what we call fecal-oral route. You contaminate the hand with fecal matters, feces, then you take it into the mouth and you ingest it.
All right. Thank you so much, Doctor. You paint a grim picture, because I was going to start by asking you, this is 2025. Why do we still have people dying from cholera? But then when you highlight all of these challenges, it does look like it's not going anywhere. It seems like it's as a result of our public health status. As long as we have damaging public health, we would have cholera. But you are the head of the Cholera Emergency Operations Center, right?
Yes.
What exactly is being done differently this time around?
Thank you very much. So this time around, we are more intentional through our Emergency Operation Coordination Center, working with the federal ministries, started with those responsibilities, Ministry of Water Resources, also Ministry of Environment, partners, and our state counterparts, the State Ministry of Health. We are in India also working with their own state Ministry of Environment, Water Resources, RUWASA as they call them, the WASH sector, water sanitation and hygiene sector. Now, our effort is being intentional because if we cannot stop the transmission, let's stop deaths. The Global Task Force on Cholera Control put it clearly that by year 2030, we want to be able to reduce deaths from cholera to less than 1%. Our current national figure stands at about 2.8%. So we have a target to ensure that nobody, as much as possible, dies from cholera cases. And how do we go about this? We've trained across all the country, in all the 36 states plus FCT, healthcare professionals. We call them case managers, who can manage cases of cholera. We taught them how to set up oral rehydration points, because you also heard from that report that ability to quickly rehydrate these cases when it occurs is a saving point intervention. So the oral rehydration salt that was mentioned, it's something that we need to put at the doorstep as much as possible, close to the people. And so with these, people have been trained across all the 36 states on how to set up the oral rehydration points, and also how to set up cholera treatment centers, cholera treatment units, very close to where the cases are from, because you don't want a situation wherein people are sick in this location and they have to travel a long distance before they can access care. In addition to this, we are also working on the water sanitation and hygiene sector by ensuring that the water sources, especially where people have challenges with water, they can easily decontaminate this water. If you don't have access to potable water, decontaminate the one you have using the there are water decontamination taps that can be used. Chlorine tablets are there that can be used to really safeguard the water that they're going to consume eventually, so that they don't come down with the disease. So if we reduce incidence, if we reduce deaths, then definitely we are closer to eliminating cholera in Nigeria.
And hopefully these centers have to do with the primary healthcare centers you're working.
So the way they are looking,
those,
yes, because they are all at the state ministries of health, the local government area, primary healthcare communities, where these oral rehydration points are set up for them to be able to manage this disease at the right time.
Thank you very much. Dr. Biodun Ogunniyi is a public health expert and is at the National Incident Manager, Cholera Emergency Operations Center, and Head Health Preparedness Emergency, NCDC. Thank you for
I would
joining
just say
us.
my parting shot that
Right.
clean water, clean hands,
Yes.
and clean environment save lives. And for us at the Nigeria Center for Disease Control, we are committed protecting the health of Nigerians,
Well,
but it's all about collective
clean
responsibility.
hands
Very
within
well
the
said.
reach of the Nigerians, but the other ones, I mean, it's government that really needs to up its
Clean your
game.
hands.
Yeah.
Clean your hands.
That's
all
within
the
your
time.
control.
You know, some people have phobia in shaking hands.
Yeah,
And I do
it's a
not
good
blame
phobia.
them.
It's a good one. I agree with such phobia.
Thank you
Wash
so
your
much.
hands.
Yeah.
Yeah.